Good afternoon, everybody. I'm Robin Strongin with National Consumers League, and I want to welcome everybody to today's webinar, our Script Your Future webinar. And today's topic is on vaccines. And we are going to be hearing from some of the schools of pharmacy, the winning teams over the last couple of years. They've actually done the work on the ground, worked with people in their communities, and have lots of lessons learned about this issue, several issues related to vaccines, particularly in the areas of underserved communities, harder to reach communities, and are here to be able to share some of those lessons that they've learned. For those of you who may not be particularly up to date on Script Your Future, we have a website, scriptyourfuture.org, where you can learn all about the program, but it is a national education campaign that started in 2011. National Consumers League has been running it for over a decade now. And one of the signature components of Script Your Future is something we lovingly refer to as the challenge, where we reach out to schools of pharmacy across the country, and there are different areas of interest where, as I mentioned before, teams come together and they work on a particular issue related to medication adherence, which is what Script Your Future is all about, and come up not just with identifying the challenge, of which there are many when it comes to adherence, but specific solutions, be it a technology solution or some kind of really creative approach. And so I am particularly excited to be hearing from the two schools who have done some remarkable work in the space of vaccines, working with pregnant moms and folks who are homeless and have heretofore had trouble accessing healthcare in their community. So we are really privileged to be able to hear from them. And the two schools we're going to hear from is NEOMED and Temple. And we have two professors from Temple, and we have a student who is about to receive her Pharm.D degree and is graduating in less than a month. And so I'm going to ask Natalie and Mark from Temple. Natalie, if you could introduce yourself, and then Mark, if you introduce yourself, and then we'll get started on jumping in. And then when we jump to the next school, Jasmeen, I'll be able to introduce you as well. So Natalie, if you would just give us a little about your title, and then a Mark, and then we'll get into it. Thank you.
Sure. So my name is Natalie Rodriguex. I am one of the clinical assistant professors at Temple University School of Pharmacy. And my specialty is in ambulatory care and internal medicine. So I also have a practice site in AmCare. And I'm one of the co-advisors with Mark for our Script Your Future team at Temple.
And you've done it a couple of years, yes? Script Your Future, the school has.
Yes, the school has been a part of it for quite some time. Mark and I took it over, I think maybe 2 or 3 years ago. I think this is our third go around this current year.
Great. Over to you, Mark.
Yeah, great. My name is Mark Cinquegrani, also a clinical assistant professor at Temple. And like Natalie mentioned, we've been doing this for our third year now, essentially since we started at Temple. And I'm also in ambulatory care and specialize in care for patients living with HIV as well.
Fabulous. Okay. So you guys actually, your teams looked at two specific projects that you did last year, and you were one of our winning teams, as I mentioned, in the Underrepresented Community Outreach Award. One was a 3-minute clinic, and the other was a community baby shower. And I think if we go to the next slide, probably the next slide or two, actually, Chelsea. Oh, these are our speakers, so we can keep moving along. I got so excited, I got ahead of ourselves. Yeah, and we'll go one more. And I think we start, maybe Natalie, I think you were gonna walk us through a little bit about the idea behind the community baby shower and what the thinking was and how you guys came to this and what you found.
Sure. So at Temple, we have an organization called Lambda Kappa Sigma, and they were working on kind of starting a community baby shower for mothers in need in the North Philadelphia community. So the North Philadelphia community is very underserved, underrepresented, low socioeconomic status, and they wanted to come up with some sort of fundraiser that would, give these expecting mothers a little bit of support as they're kind of navigating this new life that they're about to start. So last year was the first annual community baby shower, where we had signups that were sent out through the community for expecting moms or new moms to come register. And we had a program where we basically threw them a baby shower. There were games, there were gifts, there were raffles, and every mom went home with one of those backpacks that was filled with diapers and onesies and certain things. But being a school of pharmacy, it's not just about, it's also educating our local community as well. And so there was a bunch of student organizations that also partnered with Scrip Your Future and LKS here. So we had the Pediatric Association group where they created a poster on pediatric vaccinations, the importance of getting vaccines for your children, addressing some of the vaccine hesitancy and concerns that may arise for the moms. And then there was another group that also talked about vaccines during pregnancy. So vaccines that, you should get during pregnancy to ensure that the child is protected.
And can I interrupt? Did you get a lot of questions, or was there a lot of hesitancy and concern, and how did you guys deal with that?
Yeah, I think from the community baby shower standpoint, there was less hesitancy than what we've seen in some of our other community outreach events. But the students, they do get lectures in several courses about vaccine hesitancy and ways to address it. But also when they're making these posters and their flyers, faculty have to approve them. And so I always encourage them to look at the CDC resources or the APHA resources so that, if things such as hesitancy do come up, they have the tools to address them. The other reassuring thing is there's always a pharmacist with them at the poster session. So if there were any concerns that they maybe weren't too confident in handling, there's a pharmacist or faculty member there that can help address some of the concerns with them. I think from our standpoint, we also made a pamphlet for the moms. Some of the students made a pamphlet on pediatric vaccinations that was really educational and insightful. And they all were taking them and looking at them during, some of the debrief section that we had for the community baby shower, and the students were engaged with chatting with them, which was nice.
Oh, that's fantastic. Wonderful. Mark, did you attend the shower as well? Were you there? Did you see it happen?
I did not. I was unable to make it to the baby shower as some other commitments on the weekend.
Okay. Okay. And then I know you did it a second year, Natalie. Is that right?
Yeah, so the community baby shower happened 2 weeks ago, I would say. So this picture is actually from the most recent one that happened.
Okay, great.
I believe there are a few more pictures in some of the slides from the
we could probably show the next one, Chelsea, when you get a chance. But so
yeah,
what was, I see, here's one of the poster boards. Got it.
Yeah,
Got it.
And I
great.
think yeah.
What were some of the lessons that you guys took away from this particular opportunity? And related to that, do you see other schools being able to learn from this and use it and scale it up across the country? It seems like such an exciting way to reach, moms who need this information.
Yeah, so we certainly learned a lot of lessons from the first year to the second year. We had an overwhelming amount of interest our first year, and it actually exceeded our ability to, meet, we had over 150 moms sign up, and we just didn't have the space for all of them. So we had to kind of adjust, and we learned, to cap our surveys, and things like that. I think other things we learned is just touching base with our community, whether it be for donations or getting the word out there, is such a huge benefit for us. And so we, in last year and this year, we've made a lot of community touch points that will help us in future years be able to continue to make this event such a success. And then just making sure that, the students are continued to feel confident in the things that they've learned in school, so that when they are out here giving these poster presentations, they're able to confidently address any of the concerns that the patients may have.
Great.
From a scalability standpoint to other schools, I certainly think it's doable. There's definitely a lot of planning that goes into it. And so you need a good dedicated group of students, and some support from some faculty, and just the spacing for it. But I think it's a wonderful event, and the local members of the community who attend are always so grateful. For, privacy, I didn't attach any of the pictures of
course.
their stuff,
Sure.
but they were just so grateful. And when we were wrapping up, they were all coming up, giving hugs to the students, and just,
Oh, that makes
thanking
me
them
so
for,
happy.
for, everything. Because it's, especially coming from this underserved, lower socioeconomic status, it kind of gives them a little bit of a relief, right? They have a few things that, they can take off of their list.
Just such a win-win idea. Everybody comes away happy and learning, and really with something positive. And I think there are these lessons that we can share with other schools of pharmacy across the country, that they could do similar work, and not limited to schools, but within communities. And I think that's a good segue, Mark, to some of the work that you were doing and leading in the clinics as another way of reaching out to folks who maybe haven't been as reached out to as we would like to see. So why don't you share with us some of the work you were leading?
Yeah, I think that is a pretty good segue. As Natalie was mentioning, they kind of set up this space and event for the expectant mothers. The initiative that I got involved with these 3-minute clinics, we were meeting people where they were already going. So we partnered with an organization called the Children's Mission. It's a faith-based organization that did food distribution through some donations with the county or the city. And it's the second Saturday of every month. And our student organization that gets involved is the Student National Pharmacists Association. So again, partnering with a student organization that already existed, and they've already been interacting with this group. They needed a supervisor for their Saturday mornings, and it ended up being me a lot of the time. So we really just try to squeeze in our health information when our community members were already there for something else. So these community members are sometimes unhoused or underhoused in a poorer area. We do have a fair amount of Spanish speaking people that came in as well, and really have a hard time accessing care sometimes in the area that they're at. So before they can pick up their food for the day, before the line starts, the Temple students will do a 3-minute clinic on a variety of topics. And this particular one was about vaccinations. With the COVID vaccination, that's obviously been very big in the past couple of years, and then changes to pneumococcal vaccines. We were trying to go out and talk to patients about those and encourage them to talk to their physician about the appropriate vaccination for them, any questions that they had. So in addition to this 3-minute clinic at the beginning of the food distribution, when they make the circle around this room from each of the food stations, they end on the Temple Pharmacy student table. And we set ourselves up with some posters on medication adherence and vaccine confidence, as well as blood pressure screenings. So the community members basically have to pass by our students again on the way out, and can stop and ask their questions, get their blood pressure checked.
Are they given an opportunity to be vaccinated on site, or is that a follow-up step that happens?
That unfortunately is a follow-up step. We're not able to get the vaccine supply and bring it to them. Most of that is coordinated with local community pharmacies, if we can refer them over.
But you are able to make referrals, so they have a place to go.
Yeah, we definitely
to follow up.
recommend here's some other places in the area that could offer the vaccination.
And what there's a comfort level you were explaining to me when we were preparing for today, that the community members really enjoyed speaking with the students, felt very comfortable, and I thought that was a really interesting takeaway.
Yeah, I think having students be the point of contact for people in the community has been very helpful, because they may not be willing to share all of their concerns with their physician, or they don't like the idea of someone with authority telling them what to do, particularly when we see that a lot with vaccine hesitancy. Idea of vaccine requirements and someone is telling them what to do. Our students are, I feel like, more relatable for some of these community members.
That's so, were you expecting that, or was that sort of a unique takeaway, or you've seen this before?
It seemed like a unique thing that was happening, because I don't know, I always considered that community members probably had a good relationship with their physician, and we were just, another person telling them to do the same thing over and over, but they really seemed to listen. And we have, since we're there every month,
Right.
Of community members who beeline it for our table immediately every time they want to talk to the students, and recognize faces are the same.
That's, I was going to ask. So it's
like lasting relationships.
That's fantastic. Wow. And what was the debrief with the students like? What were they saying? What was their takeaway from the experience?
They really enjoy when they get to have those real conversations with patients. And like Natalie was mentioning, it does test them a little bit with whatever they've learned in class, to be able to respond to the variety of questions and reasons that patients have for talking about their health. So it's a learning opportunity for them as well, in their communication skills and in their clinical skills as well.
And some of your students were bilingual as well, I believe, right? So that was another benefit too to the interaction.
Yeah, sometimes we're lucky enough to have bilingual students with us. Sometimes not. Sometimes we rely on other community members to translate for us. But that's another lesson as well, really, and kind of working with the resources you have available
right.
at a given time.
Yeah, for sure. Anything else you want to, oh, here we go. Now, was this brochure for the clinic, for the community baby shower, for all of the above?
So this was the brochure that was given out at the community baby shower for the pediatric vaccinations.
Got it. Got it. Oh, right. Pediatric. Sure. Okay. Yep. Fantastic. And people did take it, right? They wanted it. They used it. They took it.
People were asking, they were asking good questions. The organizations, there was many organizations there, and the students just all collectively did a fantastic job. But the group that started the community baby shower, this is like their baby project, and they're just doing some incredible work with what they started, and I'm excited to kind of see it continue to grow.
See it grow for sure. Yeah, no question about it. Oh my God, it's just so exciting. And I had a question that just went right out of my head. So I want you guys to stay on while we pivot over to Jasmeen Khuban, who is with NEOMED, which is Northeast Ohio Medical University School of Pharmacy. That is a mouthful. No wonder you guys go by NEOMED. But why don't you first, congratulations on your upcoming graduation. That's really a lot of work went into this moment, I'm quite sure, and probably a lot more in front of you. And you took the time to be part of Scrip Your Future. So tell us a little bit about what you're studying. And then if you would just go right into the work, your team also won an award in 2022, and that was the Health Disparities Underserved Focus Award. And so tell us a little bit about you first, and then the project for Scrip Your Future that you participated in.
Oh, my name is Jasmeen. Again, student at NEOMED. I am pursuing a residency at the Ohio State University Health Plan. So I will be going into managed care pharmacy.
Oh,
very
wow.
shortly.
Okay. Okay. Wonderful. Are there a lot of women in your program? Just curious what the breakdown in the pharmacy school.
I would say it's a good mix.
Good mix.
I think it's pretty equal.
Oh, okay. All right. Well, congratulations on all the upcoming wonderful path ahead of you. And looking back now, tell us a little bit about the project that you participated in.
Yes. So when we were doing Scrip Your Future, it was during a time of COVID. And so one of the things that we did was reach out to all of our contacts. So all of the contacts that we had through our school between IPPE and AAHIVP preceptors, as well as faculty members, reaching out to all of them to see if we could go to their clinics or go to the federally qualified health centers that they worked at. And luckily, one of the federally qualified health centers was collaborating with the Greater Cleveland congregations to do a Dollars for Doses campaign. So that is how we were able to reach out to so many patients about vaccinations and medication adherence, because they were doing this campaign and we were allowed to go and participate, and the patients were required to sit for that 15 minutes after the vaccination. So that sort of gave us the opportunity to talk to them about their medication adherence. That played a really big role in terms of our outreach because they were required to stay there. And I feel like a lot of good went into that because many of them weren't aware of the downsides of not being adherent. And because of the patient population that we were working with, again, this was underserved patients, and in some of the poorest communities in the Cleveland area, a lot of them did not have access to any sort of resources. So we provided, I want to say, hundreds of pill boxes, wallet cards, different educational materials to all of them during these events.
Scrip Your Future wallet cards that we have,
Yes.
right? You were able to use? Good.
Yes.
Good. That was the question I was going to ask you guys at Temple also when you had the clinic, if you were able to use some of the materials that you were. Okay, fantastic. Okay, but I cut you off. I got a little excited over here. So
no, that's all right.
Were they mostly adults that you worked with, or were there under 18 as well for the COVID vaccine, or was it all 18 and above?
I would say it was mostly adults.
Okay.
I don't recall seeing too many children. I know some of them did come with their parents, but I don't recall seeing too many children.
And question for you, when you were doing all of this work, your team, you know, part of Scrip Your Future is also trying to understand the evolving role of the pharmacist in today's really complicated healthcare delivery systems, no matter how broken they are. We're always looking for other trusted members of the team, and obviously pharmacists are getting a lot of the spotlight these days since COVID in particular. Were you guys actually providing vaccine? Were you guys, the Scrip Your Future folks, students learning how to do the vaccines, watching? What was that like?
We were not the ones doing the vaccines. This event had other professions there as well. So there were a lot of nurses there, as well as social workers, because this was a community campaign.
It was already a campaign that you were able to attach the adherence component to, since you had the folks right there. Okay, got it. Much like the clinic folks were there and you were able to capitalize on a program already in place, right? Perfect.
Yes, so we were able to observe the patients post-vaccination, as well as educate them on, again, the medication adherence aspect, as well as other vaccines that they should consider.
And I am going to brag, because in the write-up that your team submitted, I just will do a shout out to say that through the efforts of the NEOMED team, 456 people were vaccinated. 1,323 patients were directly counseled on adherence, and that you guys reached almost 2,000 patients, 1,923, and distributed and donated 3,254 resources. So you really were able to reach a lot of people in your community through this program. And again, that's really, it's why you guys won. And it's what we're also looking for is how, again, do we take this and spread these successful programs that all of you here today are showcasing for us, and the lessons learned. What do we do differently? How can we as Scrip Your Future help you help people in your community? And we could talk about that offline, but if in the future there's a community baby shower and you want to go really big and have those same turnout, maybe we can help with resources or whatever, so that we don't have to cap if there's interested folks going forward, recognizing that the logistics and the resources can be terribly overwhelming. So what were some of the lessons that you learned, Jasmeen, from this experience, would you say, that you would want to share with others?
Yes, and just to clarify, those numbers were just from us working with the underserved population. During the campaign as a whole, we reached over 12,000.
Oh my God. Okay.
Yes.
Even more impressive. That's wonderful.
So
Wow.
A lot of work went into this campaign. I'm very proud of all of the work that we did. It was,
as you should be. Yeah. Yeah. Wow. Okay.
yes, it was a highlight of my pharmacy school years.
Oh, wow. That's so wonderful to hear. Oh my God. That's just terrific. Wonderful.
Yes.
Well, you're going to shake up managed care pharmacy then. We're counting on you.
I plan to
bring it back to them. Oh my God. If all of you were sitting down with folks from CDC or others at state and federal policy levels that are desperately trying to work with communities for whom misinformation is rampant, hesitancy is a problem, and you were asked to give one or two pieces of advice, tangible advice, back to these policymakers, I know I'm putting you on the spot here, probably not fair, and you can follow up, but we will be doing, honestly, we're doing so many podcasts and webinars. I think it's another webinar in early May. We're doing a roundtable with some federal and state folks on vaccines, misinformation, and hesitancy. And I'm going to send them this webinar to watch before we get together, because really hearing from people doing the groundwork and understanding what the idea that students are such a valuable resource and really listened to in the communities. I mean, why not use students? I mean, I know there are legal issues and all the other reasons, but I mean, we can be creative. We can all figure this out. There are real big problems. So anyway, I'll stop talking and let you guys answer. Any suggestions, thoughts, things not to do? It's not always something to do. Are there things that are happening that need to stop or be done differently? Anyone? Not off the top of your head. Okay, fair enough. Fair enough.
At it, I guess.
Yeah. Okay, go for it. No wrong answers.
Well, like I mentioned, I work primarily in the HIV space, and so I deal with a lot of disease stigma. And we've started using peer navigators or patient advocates.
Okay.
So people living with HIV talking to other patients living with HIV about medication adherence and the day-to-day struggles that they experience. And I think we're seeing something similar with our students, like the community baby shower. It was one of the sororities, so primarily female students involved reaching out to expectant mothers. Our student population at Temple is very diverse and fits in pretty well with our overall North Philadelphia patient population. So taking advantage of the similarities, I guess, between our students and the patient population so that they feel comfortable talking to each other. trying to break down some of the stigma, or the hesitancy really is the word, to talk to someone who maybe patients don't think can relate to them.
Got it.
I don't know what sorts of recommendations we make on like a large policy level around that, other than encouraging diverse workforces and diverse volunteer activities.
Well, that seems like a really important one. So, and it seems like the students are very comfortable in this role. Do you guys as students and as professors, is that specific training that students in pharmacy school have, is how to talk to patients about these clinical matters? How, like, what is the curricula like currently? And is there a role for more of that in the future? How does that work? It's probably school to school, but is that a thing?
It is.
Okay.
Jasmine, do you want to go first and talk about your perspective as a student, and then I'll talk about the faculty side?
Great.
Yes. So as a student, we do have sort of these mock patient interview sessions where we get to learn how to counsel patients. And I find that those are very beneficial, but nothing compares to actually being in front of a patient. This is why schools strongly encouraging having an internship makes a big difference. Our school also has a free clinic. I am one of the patient education team leaders there. So being able to talk to patients one-on-one and relate to them is one of the most important things that I learned, and even learned from this campaign, because we see things, we see things from a healthcare standpoint from that perspective, but being able to relate to what the patient is going through and establishing trust, that's one of the biggest things that you get from actually being in front of a patient. And one of the biggest things that we got from just being the work that we did during the campaign, being able to relate to them and having us just not be a student and having them not just be a patient, but another person.
Yeah. Wow. Okay. Fantastic. Thank you. Mark, you were going to come in with from a professor's point of view here.
Yeah, over at Temple, we do have a communications course that our second years go through in their fall semester, which lines up at right about the time that they'll be out doing a lot of these community events. So they get a full semester of communication activities in conjunction with a lot of these community outreach work. We're also making concerted efforts to include more social determinant of health information. Sure. Starting as early as the first year. So getting them thinking about communities other than their own, and expanding on some of that training and knowledge.
Yeah.
Did I miss anything?
I was just going to add, they also, going into their third year rotation, they get a motivational interviewing seminar. So they learn the skills about how to, conduct a motivational interviewing session and, kind of roll with some of that resistance that you may encounter in the real world clinical setting. What I was just going to add on, in addition to what everyone has said so far, but a lot of the times I'm precepting some of these events with the students, and we do a weekly one in our clinic that just reaches the patients where they're at. They have to wait in the waiting room to see their doctor. So what a perfect opportunity to reach some of those patients and talk about all of the different things that the Scrip Your Future initiative has. And the very first time the students come in, they're like, "Oh, Dr. Rodriguez, I'm so afraid to talk to a patient." And I'm like, it's just a conversation. Like, it's just another person. Go ahead. You can pair up the first time you do it. And then by the end of the 3-hour volunteer session, they're like, "Oh, that really wasn't that bad." And I'm like, "I told you it wasn't that bad." So it's really just getting them out there. And the more that they get out there, the more comfortable that they are with it. But the amount of nerves that you see early in those sessions is is very high compared to where they end at the end. They're like, oh, that, and they feel accomplished at the end. So it's kind of cool
Sure, I
to see them
bet.
be proud
Yeah.
of themselves for, you know, stepping a little bit outside of their comfort zone. Yeah.
Love that. Was that your experience, Jasmeen, too? Were you nervous at first?
Yes, always nervous at first, but it's usually just the first few times, and then once you've done it so many times, you just get the hang of it. I feel like it all comes down to just having more exposure and more experience. I feel like that's what makes that the big difference.
And the other takeaway I hear you guys all saying is the word trust. And, you know, we do a lot of work on mis and disinformation. Obviously, vaccines is a big area, but it really just is everywhere within health and medicine, unfortunately, these days, in every aspect. And even counseling folks where to go for information and who is a trusted person and a trusted source is so difficult and getting more difficult. So these kinds of insights and opportunities to talk and connect with real people in real communities with real students and professors, I think is something to pay close attention to, and you can be sure it will be front and center on the next webinar we're doing with all these policymakers, because I even wonder if your schools sometime in the future would be open to a site visit from some of these policymakers to see this in action. I used to work 100 years ago somewhere, and we would take Capitol Hill staff to, you know, real clinics and real where people didn't have running water, and, you know, what it was like to make policy in one place, but then see what was going on in the lives of real people. And it is, as you said, there's nothing takes the place as the real interaction and real experience. So maybe down the line, we'll talk about a field trip or a site visit for some policy folks to see this in action with all the appropriate HIPAA privacy requirements and all of that sort of a thing. But we'll, you know, we'll navigate that properly. So with that, I just cannot thank you all enough. I'm so excited to hear that I learned so much. I really can't thank you all enough for your time. We are going to be posting this on Script Your Future. We will share the webinar with all of you, and we will be promoting it far and wide. If anyone has any parting thoughts or comments they want to share, feel free. We have your little write-up on Script Your Future on the website. Under the challenge, there's a tab that's called winners, and each one is there. And I think, Chelsea, on the last slide, if we can go back to the slides, we have contact information, but you can always reach me at robins@nclnet.org and on scriptyourfuture.org. And we're coming up to that last slide. There it is. And with that, I'm going to say thank you all to our panelists, and we will be back in touch, you can be sure. And congratulations, Jasmeen, and thanks again to the professors from Temple. Thanks, everybody. Have a good evening. Bye now. Yep,
Bye-bye.
thanks.